Now let's begin with our systematic interpretation. Again, we will use a system called the ABCD system, where A stands for adequacy / alignment, B stands for bones, C for cartilage, and D for dense soft tissues. So this is the system that we are going to use throughout our discussion today. Now, let's see about the lateral view. Lateral view, we will first look for adequacy. We will say that this film is it adequate or not? Can I interpret this film or not? How will you decide? If an adequate lateral view should have occipital condyles to the top of T1. So you should be able to see the occipital condyles above and the top of T1 below. So this is your C1. This is your C2, 3, 4, 5, 6, 7, and this is your T1. So the top of T1 and these are your occipital condyles. So if this is visible, then this is an adequate. All your spinous processes and soft tissue in front of the vertebrae. So you are able to see all your spinous processes, and this is the soft tissue in front of the vertebrae. You are able to see. So this is called an adequate exposed lateral film. Now, when it comes to alignment, there are 4 lines, 1, 2, 3, 4 in a lateral view. The first one is your anterior vertebral line, which runs through the anterior borders of the vertebral bodies, and your posterior vertebral line, which runs through the posterior edges of your vertebral bodies. And the third line is your spinolaminar line. And the fourth line is your spinous processes line. So these are the 4 lines that should form a smooth curve, a smooth, free-flowing, straight curve. They are not very strictly straight lines, but they are fairly continuous, smoothly curved lines. So this will tell you the alignment. If all the 4 lines are smoothly, freely flowing and continuous, non-interrupted, then it means that the alignment is good. In certain special considerations, one is called the Harris ring, which is seen on the C2 of your in the lateral view. So this is a ring-like structure that is seen on the vertebral body number 2 in a lateral view. Now this may be incomplete in your 5 o'clock or 7 o'clock position. So somewhere here it might be incomplete. But if this ring is incomplete in any other place, then that will be an abnormal X-ray. Now, the second one is B. Alignment adequacy is over. Let's go to the B's. What you should look in the B is each and every vertebral body should be roughly rectangular in shape. Now, B for bones, look at the vertebral body. Is it roughly rectangular in shape or not? Each and every vertebral body, you need to scan and see if they're roughly rectangular. Now, the next section is C, which is for cartilage. Now, what you need to see in cartilage is the height of the intervertebral space. Now, uniform height. So the space should be uniform between each and every vertebral body, and also the space, it should be on the left and the right should be equal. So each and every space should be equal, and the distance between your C1 C2 articulation is less than 3 millimeters. So this is your C1 arch and this is your C2 peg. The distance between the C1, this is the soft tissue distance, cartilaginous distance between your C1 and C2 articulation space should be less than 3 millimeters. Each vertebral, intervertebral height should be fairly equal. Now, there is a special consideration in the cases of atlanto-occipital subluxation, which is called your Harris rule of 12. The basio, which means that the basion dental interval. So this is your basion and this is your tip of the dents. So this basio-dental interval should be less than 12 millimeters, and your basion and posterior axial line. So this is your posterior axial line. So this is anteriorly, and this is your posterior axial line. The distance between your basion and your posterior axillary line should be less than 12 millimeters. So this is basio-dens and basio-axial distance. So these two distances would be less than 12 millimeters. So if it is more than 12 millimeters, then you need to think of atlanto-occipital subluxation. So atlanto-occipital subluxation is usually not very well visible, obviously, on a spinal X-ray. So if you have any doubt in your measurements, then you need to go for a CT scan. And then you need to look at the D, which is dense soft tissues, which from C1 to C4, the distance between the soft tissue matter and the vertebral body should be less than 7 millimeters, which means the soft tissue should occupy roughly 1/3 of the lateral diameter of the vertebral body. When you're dealing with C5 to C7, this soft tissue density is almost equal to the lateral diameter of the vertebral body, which is roughly around 22 millimeters maximum. So C1 to C4, 7 millimeters. C5 to C7, it is 22 millimeters. So roughly here, the soft tissue will be roughly 1/3 of the lateral diameter of the vertebral bodies, and here it will be almost equidistant. Now, that is about your lateral view. Now let's see about AP view. How will you decide if it's adequate? You should be able to see the inferior border of C2 to the top of T1. So C2, C3, C4, C5, C6, C7, and this is your top of T1. So C2 to T1 is your adequate X-ray. Alignment, again here there will be 3 lines. One line is your spinous processes line. Second line is your foramina line on the left and the foramina line on the right. All 3 of them should be fairly straight. Now B is for bones. Each bone should be assessed individually for any structural deformity or any obvious injuries. Now coming to cartilage, here again the space between the 2 cartilages should be equal, and also it should be symmetrical. On the left, the space should be equal on the left and on the right as well. All the spaces should be equal in height and similarly symmetrical on the left and right. Soft tissues, look at the paravertebral soft tissue densities. So is there any abnormal hyperdensities in the paravertebral soft tissues? It may indicate a bleeding hematoma, rapidly swelling in the neck, which may soon compromise your airway. Now the third view is your open mouth view. Now how will you see if this is adequate? You should be able to see the whole of the odontoid process of C2 and lateral masses of C1 and C2. So this is your odontoid process of C2, and this is the lateral mass of C1, and this is the lateral mass of C2. Alignment, your lateral mass of C1 should be in line with your lateral mass of C2. Lateral mass of C1 is in alignment with the lateral mass of C2. So this is an aligned open mouth view. Now look for individual bones like your odontoid process of C2, and the peg fractures are common around the base of the odontoid process. So this is where usually the odontoid peg fractures happen. So look for each and every bone to look for any obvious fractures or any structural abnormalities. Now, there is something called a Mach effect, where the you may feel that this is the fracture of the odontoid peg, but this is actually the base of the skull superimposing upon the peg. So this is your open mouth view, and this is your base of the skull that is superimposing on the base of the odontoid peg. Now, because peg fractures are very common at the base of the odontoid peg, you may confuse this as a fracture, but this is usually a Mach effect. It's just an adjustment in the position of the patient will eliminate this effect. Now, in the open mouth view, look at the cartilaginous spaces. Now, the space should be uniform on either side of the peg. Now, let's say this is your lateral mass of C1, this is the lateral mass of C2, this is your peg, and this is your lateral masses of C2. Now, the soft tissue spaces should be equal on the both sides. So the soft tissue space or the cartilaginous space on the right and the left should be same. There might be some asymmetry because of rotation effect, but if you think that is the case, look at the alignment of the lateral masses. If they are well aligned, even a slight asymmetry of the space is still normal. It may be because of some rotation effect. And then you need to look at the paravertebral soft tissue spaces. Again, that may indicate any swelling or masses or expanding hematomas. Now, I know that you will not be able to respond to my questions, but we will give you 30 seconds to 1 minute to practice interpreting the following X-rays. Now, use this X-ray in a systematic ABCD approach. Look for alignment, bones, adequacy, bones, cartilaginous, and soft tissue densities, and tell me what's wrong with this patient.
I invite all the attendees to please write your questions in the chat box. So we have got an answer.
Yes, just check that. There is an answer that says it's a normal X-ray, and that is the right answer. So the adequacy is good, the alignment is good, the bones are all fairly normal, and the cartilaginous spaces are good, and the soft tissue densities are also good. So this is a normal looking X-ray. Yes. So let's proceed on to the next section, that is our thoracolumbar spine. So we have finished interpreting assessment of the cervical spine to request for a spinal X-ray. And once we have gotten the spinal X-ray, we're using a systematic ABCD approach to interpret that X-ray. Now let's do the thoracolumbar spine. Now, a bit of context with related to trauma. For thoracolumbar spine, they are more stable than your cervical spine X-rays, and usually there might be some non-contiguous fractures. Non-contiguous ante, if the patient is having a C-spine fracture, think about the probability of having fractures in other spinal region increases by at least 30 to 35%. So a non-contiguous fractures, now the patient may have D1, D2, D3 fracture, and somewhere he goes down and can have a D10, D11 fractures as well. So non-contiguous fractures are common in your thoracolumbar spine. Now, thoracolumbar spinal X-ray views. On your cervical spine, you have three views: AP, lateral, and open mouth view. Now, in thoracolumbar spine, The views are only lateral and AP. Now, once you request the spine X-rays, you will use again your ABCD approach to interpret your spinal X-rays. Look at the adequacy and alignment, bones, cartilages, and soft tissue densities. Now, adequacy of a thoracic spine X-ray should incorporate the L1. So from the top of T1 to the including L1 is what you should be able to see in a thoracic spine X-ray, be it AP or a lateral. When it comes to lumbar spine, should include the upper part of the sacrum. So these are the only two basic criteria that are needed to adequately interpret an thoracico-lumbar spine. Now, this is one view of your a lateral view where you're and the same patients. This is your AP view. So I'm not sure how well my screen is, but still we'll try to count. So this would be your T1, T2, and this is your T3. So if you look at your T3, it's clearly fractured here. But here in the lateral view, because of the soft tissue masses that happens from your shoulder and your heart, the upper vertebral bodies are usually not well visible on your lateral view. So that is why it is important to request both the views and involve analyzing especially the upper thoracic vertebrae should be analyzed using both the views. Now, when it comes to alignment in the lateral view, just like your cervical spine, you have 4 lines, but in the thoracolumbar views, there are only 2 lines. They are anterior and posterior limits of the vertebral bodies. Are they aligned well or not? So these are the 2 things that you need to see in a lateral view. And in the AP view, again, you have 3 lines. You have your spinous processes, all should be fairly in a straight line. And your lateral processes, which is your pedicles, should be aligned in your straight line. So remember, there could be a significant amount of rotation that can happen. And so and also your vertebral bodies widen as they go as you come down. So you can see this is fairly rectangular, and when you're going down the lumbar to the sacrum, your vertebral bodies widen. So naturally your pedicular lines laterally also will widen, but remember, it should be a smooth lateral curve, and spinous process line should be fairly straight. So that's your alignment. Now again, when it comes to bones, each and every bone should be fully assessed for injury or structural abnormalities. Again, cartilages, there are 2 things that you need to look for is symmetry and equidistant from spinous processes or not. So symmetry on the left and right and equidistant in each of the intervertebral disc space is what you need to look for in cartilages. Dense soft tissues, parasternal soft tissue shadow on the left side. So if you see the upper thoracic vertebra, there will be a parasternal soft tissue shadow on the left side. So this is what we are talking about. So this soft tissue shadow on the left is because of the pleural thickening. So on the left lung, the pleural edge, you can see this. I'm not sure if this line is very much visible. So this is your lateral border of your cervical or thoracic vertebral, and you can see this line there along the edge of the cursor where I'm scrolling it up. So this is you call your parasternal soft tissue shadow, which is formed because of the pleural folding on the left side of the lung. So it is abnormal if it is present bilaterally or if there is a localized swelling on one side. which indicates probably a hemothorax or a cardiac tamponade. So if it is present bilaterally, it is abnormal, or if it is a localized swelling in that soft tissue line, that may indicate any bleeding in the pleura or the pericardium. So that is about your thoracolumbar spines using an ABCD approach. And now we will again look at some practice X-rays. Now comment on this X-ray using your ABCD approach.
Sir, we have an answer.
Yes. So that I'm waiting and also straightening. So there is a hypertense anterior vertebral line and straightening of the vertebral line. So this is what you're referring to. That is probably because of the age-related osteoporosis that tends to happen anteriorly. Now look at the alignment. So basically, what we are looking at is the lumbar vertebrae. Adequacy involves the sacral upper sacrum, so that is adequate. And then alignment. So if you draw a straight line along the anterior vertebral, seems aligned, but here there is, when it comes to the lower vertebral bodies, there is a slightly drop in the alignment, especially down here. Now, if you trace the posterior vertebral line, yes, again, this alignment is lost here. Now, if you look at the bones, there is roughly rectangular, 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 rectangular. But this seems to be the L5 vertebral body seems to be reduced in height. Now, compare the height of the vertebral bodies all across here and the height of the vertebral body here. The height of the vertebral body seems to be reduced. Now, see for cartilages, intervertebral cartilaginous height is fairly normal, but when it comes here, it becomes asymmetric. Now, on the left and the right, the distance is same, but here it is more on the left, and anteriorly it's more, posteriorly it's less. So by combining all this, it indicates probably a wedge compression fracture of L5. Yes.